Welcome to the Knox Maternal and Child Health Infant Nutrition video. Our aim is to guide you and your family on infant nutrition and the questions you may have regarding commencing solids for your baby. When to start solids. Solids can be introduced to your baby when they're showing signs of readiness. This is generally around 6 months, but not before 4 months. Some signs that your baby may be ready for solids are that they're showing an interest in food. They may look at what's on your plate or what you have in your hand, and they may start to reach out for food. They may open their mouth when you offer food on a spoon. It is important when starting solids that your baby has good head control and can sit upright when supported. To ensure baby safety, it is recommended to sit baby in a high chair with a 5-point safety harness and always stay with baby while eating. Signs of readiness are different for all babies. Let your baby's individual development guide you when working out the best time to commence solids. If your baby is showing you that they are not ready, try again on another day. Do not force it. Starting solids is best thought of as a stage, not an age. When introducing solids, it is important that you and your baby are happy and relaxed. Baby will be more likely to try some food after a breastfeed or formula feed. They will still have space for food, as first foods are only in small amounts. Learning to eat solid food takes time, so be patient with your baby. Some babies begin this journey with more enthusiasm than others. You can choose what time of day to offer solids. Remember, food should be enjoyable, so be guided what works best for you and your family. Generally, babies start with 1 meal a day, and this may be only 1 teaspoon to start with, and gradually increase this amount to your baby's appetite. Observe your baby for signs that they are hungry. For example, getting excited when they see food, leaning forward in their chair and opening their mouth for food. Some signs that baby has had enough or no longer interested are turning their head away and pushing the spoon away. We do not need to force our babies to eat. They will eat when they're hungry, and this goes for toddlers as well. Once your baby is getting the hang of eating, you can implement a more set meal time that works for you and your family. Remember, if your baby does not seem interested in eating or trying new foods, wait a few days and try again. When your baby is ready for first foods, they should be smooth, mashed, or in soft pieces. As baby gains confidence with eating and chewing, increase the textures to minced foods and then eventually to chopped foods. You can see an example of smooth foods and increasing textures of food in this picture. Smooth foods are only required for a very short time, and increasing texture in their diet is important. Although baby may not always agree, the key is to keep offering. Variety of textures helps your baby learn to chew, and this is an important part of development. Increasing texture of food encourages self-feeding and reduces food fussiness. By 12 months of age, your baby should be eating the same food as you and your family, but you may still need to chop it into smaller pieces so that they can handle it a little better. It is important that first foods contain some iron, as baby's iron stores are reducing by 6 months of age. This includes iron-enriched infant cereals, red meat, poultry, fish, cooked tofu and cooked eggs. These iron-rich foods can be added to other healthy foods. For example, vegetables like cooked pumpkin, sweet potatoes, cauliflower and broccoli. Some fruits like bananas, avocados, cooked apples and soft melons. An example of some grains would be oats, bread, rice and pasta, and dairy foods like full-fat yogurt and cheese. Foods can be added in any order, provided iron-rich foods are their first foods. You do not have to try each food separately and wait for a certain amount of days. With a variety of foods being offered, baby will get to try many new tastes and textures. It may take 10 attempts of a new food until baby becomes accustomed to this food and enjoys it. Keep trying, do not give up, and continue to offer a variety of flavours. Here is an example of increasing textures and some soft fruits and larger pieces of cooked vegetables that your baby can be offered as they master solids. Finger foods are a great way to encourage new tastes, textures and independent eating. If your baby does not want to take food from a spoon, offer finger foods instead. Some good beginner finger foods are well-cooked vegetables, and that these can be squished between your finger and your thumb. Babies can begin finger foods as soon as they're able to hold on to foods, and by 8 to 9 months, most are enjoying the independence that finger food brings. Here are some examples of some vegetables, fruit and sliced meat. And remember, always supervise your baby while eating. Parents are often concerned about babies gagging and choking when introducing solids, and this is quite normal to feel this way. Like any new skill, practice is important, and eating is the same. Your concerns will reduce in time as you see your baby grow and learn these amazing new skills. Gagging is a normal response for babies when eating lumpier foods. Gagging is protective and it is there to keep their airway safe. Gagging is temporary while baby is learning new skills of chewing and swallowing more textures. And babies are generally able to work through these experiences very well. The differences between gagging and choking are outlined on this picture. Gagging is loud and noisy, and babies get red in the face and their eyes can water. Choking is generally quiet, and babies can have a panicked look on their face, and instead of a red face, their skin or lips can look blue. Choking hazard foods would be small hard foods like peanuts, uncooked carrot, popcorn, hard lollies, grapes, or large blueberries. You can grate at-risk foods like apple and cheese and carrots and let babies enjoy these as finger foods instead. Starting solids is a good time to update your first aid skills to support your family, and Raising Children website has some great information on first aid. Remember, if loud and red, let them go ahead. If silent and blue, they need help from you. Offer cooled boiled water in a sipper cup from 6 months. No exact amount is required, but you can offer water in a cup at mealtimes or at other times during the day. It takes time to learn to drink from a cup, so the more opportunities you give your baby, the sooner their skills will develop. It's common early on that babies will not like the taste of water as they're used to milk, but keep offering and they will soon learn to enjoy it. Milk or water is the only fluid babies require, so avoid fruit juice and soft drinks. All babies should be given allergenic foods, including peanut butter, cooked egg, dairy and wheat products in their first year of life. Introduce these foods according to what the family usually eats. There is some evidence to suggest that these foods should not be delayed at all. Some babies will develop food allergies. If there is a reaction to any food, for example, swelling of the lips, face or vomiting, stop that food and seek advice from your doctor. Please refer to the websites at the end of this video for further information. can introduce a small amount of cow's milk on cereal and in foods from 6 months. Whole cow's milk is not to be used as the main source of milk until 12 months. Other foods to avoid are raw eggs and honey until after 12 months, and avoid adding salt or sugar into your baby's diet until they are older. Your baby's bowel movements will change once solid food is introduced. Their stools generally become firmer, and you may see some undigested food in their nappy. This is normal and no cause for concern. Offering water in a sipper cup can assist you with softening of the stools. Mealtimes should be enjoyable for all the family. Eat regularly as a family, as this is good role modelling and babies learn from observing and copying you. As a parent, our job is to provide the variety of good foods, and your baby will decide if they want to eat at this time. We do not need to force our babies to eat, and they will eat when they're hungry. Listen to your baby and their appetite cues. Here are some useful websites you can visit for further information. Thank you for taking the time to watch this video. If you have further questions regarding introduction of solids, please contact your maternal child health nurse. There is also an email address on this page if you have further questions regarding infant nutrition. And remember, eating should be enjoyable and a positive experience for all. Thank you.